Well, I think we're going to shift gears a little bit now, moving on to robotic technologies. Now, there's been some big breakthroughs in recent years. American Hospital Dubai first began their robotic technologies at the start of last year. To date, they've now conducted around 350 robotic surgeries, including recently in Dubai, the first ever robotic assisted technology, a successful treatment for a British man here in Dubai. Now, I'm delighted to welcome someone who is considered an expert in robotic surgeries. He regularly performs a variety of complex surgeries such as colorectal, hernia and thyroid. Please welcome Dr. Hatim Musa. Thank you so much, Dr. Hatim. So let's take a look first of all at how this stand works. I've been checking it out this morning. Let's take a look. If we move the camera around a little bit, you can see how interactive it is when I place my hand over here. Tell me what exactly is going on.
So here, this system here exploring the varieties of surgeries that we can do using the robotic surgery. So there are different fields, general surgery, gynecology, urology, as well as we added a new service, the orthopedics. We use a different robotic system, part of the vision of the hospital to sponsor and adapt all the robotic technology. So basically here, as we can see, this is gynecology. We can do different types of surgery. We can use only a small tumor in the uterine wall, or we can remove the whole tumor, or can remove the whole uterus out using the robotic. The orthopedic system that we use now, called the ROSA, this is actually the first in the region, in the country, that we use a knee replacement. It's a full robotic system. It's not only a navigator, it's just full robotic system that we can use robotic instruments to remove the knee and replace the knee with the new device. So basically the advantages of this robotic surgery would be definitely it's less hospital stay. Patients can go back home quicker to his home, to his work. Actually can work back right after the surgery, a few weeks. Less rehabilitation, less physical therapy, less pain and less pain medications and antibiotics. All this benefit from robotic surgery. The other that if we can see here, for example, the general surgery. So basically, we provide different types of general surgery from the abdominal wall hernias to colorectal, the morbid obesity surgery as well. We can perform using the robotic surgery. It's a wide varieties of surgeries that we can perform using robotics. We have performed so far more than 350 cases since we start our program in January 2020. And in spite of the pandemics and the restrictions, still we're able to perform this type of surgery. It's a remote surgery. Actually, we helped a lot of patients, a lot of other hospitals referring patients to us because we can perform this surgery remotely away from the patient, which basically helped us a lot to help the patients and provide the best care in that tough time that the whole world has faced. So basically, we can provide management and treatment for cancer, for benign tumor. We can also provide surgeries for the morbidly obese patients, any types of hernias we can provide. It's a quicker time. Patient stays in the hospital only for maybe the same day, can be discharged, go back to work, no pain medicine, less antibiotics, quicker recovery, and all this benefit of robotic surgery in general. But we have seen the difference, really. We have seen how much we can help our patients get quicker and how can with technology helps providing the best care to our patients and our community.
Absolutely. I think really improving their recovery, improving their quality of life overall is so key to the medical profession today. Do you think there's enough understanding about robotic surgeries in Dubai or this part of the world yet?
Yeah, this is one of the challenges we have faced initially when we started this robotic surgery, because a lot of people who don't understand what robotic surgery is. So basically, we keep telling them that the surgeon is by himself is doing the surgery, is not the robot. The robot is just an instrument to help the surgeon perform the surgery. So I keep telling them the same thing. It's like a computer between the surgeon and the patient, delivering a better care, a better visualization with less risk of bleeding, less risk of complication that could happen during the surgery. You do it through a small, tiny incision. So this is the culture that we have to educate patients about it, that robotic surgery is not something done by the robot. The robot is just a surgical instrument. Yeah.
Now, American Hospital Dubai is really considered a leader in robotic surgery. What do you think the future of healthcare, the future of robotic surgeries really looks like today?
I think this is the future, whether you, sorry for that, like it or not. So this is the future with the implementation of the artificial intelligence and technology. And since we are the first one to get this technology, the Da Vinci Xi, so basically I think a lot of surgeries that will be done laparoscopic now or traditional open way, it will be done robotically. A lot of companies coming to market, a lot of other technologies coming, and this definitely will be the future for them. Absolutely.
Now, I think the other interesting things about American Hospital Dubai, there's a lot of hospitals out there who claim to have different options available, but AHD really is the only location that actually provides training officially in robotic surgeries.
Yeah, actually, this is what we're trying to do since day one, to provide this training to a lot of our colleagues and provide training to not only to surgeons, to the whole team. So provide training to the nurses, to the first assistant, to the coordinator. We can help establishing the whole program. It's not just only surgeon to surgeon. And we are as international proctor to robotic surgery. We are authorized to provide this kind of training, and we have the tool, we have the experience, we have the support to provide this training, and that's exactly what makes us different than other hospitals. Absolutely, yes.
And tell me, what can people expect if they come to the stand here today? It obviously is very interactive. Let's take another quick look with the camera here. What can people expect firsthand if they want to experience something a bit different today?
So this is the gynae. So basically, it will come up here. Yeah, it will come up here as the advantage of gynecology surgery. Here is urology. So actually, this is very innovative. It's a very nice way of doing it. So this urology, the benefit of urology surgery by doing it robotically, less bleeding, faster recovery, earlier return to normal life. For orthopedics, the same thing here. Yeah. Different types of urology surgery, adrenalectomy or partial or total nephrectomy, removing the whole kidney or part of the kidney. Let's move to orthopedics here. So trying to have the whole booth with no-touch technique. All right, so here's the this is the whole service that we provide with general surgery, orthopedics, urology, gynecology. So let's move to the general surgery. Yeah, and that moves down there. So this is the advantage of having a robot operating on general surgery field. Again, it is more about the cosmetic outcome. There's different types of surgery. We provide the stomach. We can do the morbid obesity surgery or any benign or cancerous lesion in the stomach. We can remove part of the stomach or whole stomach. Same thing we can provide for abdominal wall hernias. We do it robotically, small incision, much less pain and much less requirement for pain medications. Small bowel surgery, either benign or cancerous, we can do it as well with the robots. Here is the gallbladder. We can do it from single site only or 4 incisions as some other surgeons do, but we can do it as well from single incision. Colon or rectum cancer as well, we can do it robotically, a small narrow incision as well. These are all varieties of surgery we can provide using the robots.
I mean, it really is fascinating, isn't it? The technological breakthroughs that are available. Dr. Hatim Musa, thank you so much for your time today. We really appreciate it.